One of the things I think Cornwall Hospice Care would like to be remembered for and would like to be recognised as being important in is raising awareness of people who are dying, who may have a palliative diagnosis, so they're not going to get better, but they still want to live until they die, and it's about maximising that time. So in terms of raising awareness, there are many levels that we do that, and I'd just like to talk about two quickly. One is public awareness. So if I think back over the last couple of years, we were instrumental, along with the organ donation service, in running a campaign that was raising awareness of what to do. One, if somebody died suddenly, but one, if somebody died. And we were trying to reach people that wouldn't ordinarily be having those conversations. It started off and it really took off with the young farmers who adopted it. And what we ran jointly was a campaign that was called Pass It On Before You Pass Away. And what that did was foster conversations in families who would not have had those conversations otherwise, to think about saying what it is they would like if they died suddenly, whether they would want to donate their organs. And so for us, that's opening up a whole area of practice that actually nobody'd even dipped their toe in before. And that was raising awareness. The other way of raising awareness would be to think about palliative medicine and the art and science of looking after people who are dying, and how skillful it is, but how interesting and rewarding it is. We raise that awareness with the medical students. We're training doctors all the time, so as well as the medical students that we have at any one time in the organisation, we also have currently 3 GP registrars training to be GPs, and we've been doing that for many years in Cornwall, and they're people who either go back into general practice in Cornwall or go and be general practitioners somewhere else, but we're raising that awareness of what difference a hospice can make, what difference Cornwall Hospice Care can make. And what's really lovely now is that you can see that people who came to us as medical students are now wanting to come back and work with us as doctors. So the doctor who started here in February first came to us as a medical student. How lovely is that? And what does that say about what we're trying to do as an organisation?